guys to another YouTube video. The previous episode I did something about premature ejaculation. I did about causes, complication, risk factors, and solutions. How can you solve premature ejaculation? So if you have not watched the video, please just watch the previous episode. You'll learn a lot, right? So today I'm going to do something about delayed ejaculation. Delayed ejaculation. So welcome, guys. If you have not subscribed, please remember to do so. Please subscribe, like, and share the video, right? And please let's interact in the comment section. I hope you learn as much as you can in this video, right? Yes. So let's get started. So what is delayed ejaculation? Maybe you've ever wondered what is this? Maybe you take too long to ejaculate, right? So this is the time. Let's talk about delayed ejaculation, right? So what is it basically? What is delayed ejaculation? So delayed ejaculation basically means that you have a marked delay, or you have infrequency in ejaculation, or you have you totally cannot achieve ejaculation during sexual intercourse, what we call an ejaculation. So what do we mean by marked delay in ejaculation? So basically, the range is 30 to 45 minutes during sexual intercourse. If you really want to ejaculate, right? Because again, you can delay ejaculation for as much as you can. If you can remember, we talked about techniques of solving premature ejaculation, where we talked about post-squeeze technique. With post-squeeze technique, you can delay ejaculation as much as you can, right? Or the start-stop technique, where you use the stop-start technique, where after sexual stimulation, when you are about to ejaculate, you stop, relax a bit, then you start again. So with this technique, you can really delay ejaculation. With the squeeze, the post-squeeze technique or the stop-start technique, you can delay ejaculation as much as you can. That is your desire, right? But in delayed ejaculation, you have marked delay ejaculation. Not that you want to delay it, but you really achieve orgasm or you reach sexual climax with a lot of difficulty, right? So you really want to ejaculate maybe after 10 minutes, maybe after 15 minutes, you really feel that you need to ejaculate. But you cannot achieve ejaculation, right? Or you achieve ejaculation with a lot of difficulty, right? So that is what we call delayed ejaculation. We are saying that you have marked delay in ejaculation, or even there are people who cannot totally achieve ejaculation, right? They cannot achieve ejaculation. They really want to ejaculate, or they really want to reach that orgasm, but again, they cannot manage, or they achieve it with a great difficulty. So that is what we call delayed ejaculation. However, before we diagnose delayed ejaculation, you cannot just have maybe you have delayed ejaculation on one or two occasions, then you conclude you have delayed ejaculation. No, that is not the case. So the symptoms of delayed ejaculation must be there for at least a minimum period of 6 months. You have marked delay in ejaculation, that is, let's say 30 to 45 minutes. You really want to ejaculate, but within 30 to 45 minutes, still you cannot ejaculate, or you totally cannot achieve orgasm, what we call an ejaculation, right? For a minimum period of at least 6 months, right? So this has been a continuous problem in a period of 6 months, right? A minimum period of 6 months. It can be longer, right? In 75 to 100% of situation where you are having sex, right? So basically, delayed ejaculation, what is it? It means that you have marked delay in ejaculation. With marked delay in ejaculation, what we basically mean is that you cannot achieve ejaculation within for as long as 30 to 45 minutes when it truly is you have a desire to ejaculate, right? You really want to ejaculate. Maybe after 5 minutes you feel that you are okay, right? On your side, you want to ejaculate, right? But you really you really cannot achieve it, right? You achieve it maybe after 30 to 45 minutes. That's the duration that's given for delayed ejaculation. 30 to 45 minutes. You really want to ejaculate maybe after 10 minutes, but you cannot achieve it at that time. Maybe after 1 minute of your honest work, you really want to ejaculate, but you cannot achieve it, right? Or there are people who are they cannot achieve ejaculation totally. That is what we call an ejaculation, right? So you have marked delay in ejaculation, or even the absence of ejaculation during sexual activity for a minimum period of at least 6 months, right? For a minimum period of at least 6 months. So you cannot just have maybe you had the sexual intercourse maybe for 1 week, then you had delayed ejaculation, then you conclude you have premature ejaculation, right? No, that's not the case. It should be a continuous process, maybe for at least 6 months of these symptoms. You have marked delay in ejaculation, maybe lasting 30 to 45 minutes. If you truly want to ejaculate, it is not your desire to delay ejaculation, right? Or you absolutely don't achieve ejaculation, right? Yes, so the duration is 30 to 45 minutes, a minimum period of at least 6 months. The symptoms are continuous, right? And this causes you a lot of maybe stress, a lot of distress, right? So that is what we call premature ejaculation. You really need a lot of sexual stimulation to reach your climax. And again, you achieve orgasm with a great difficulty, right? Maybe after 10 minutes, maybe after 5 minutes of honest work, you really want to ejaculate and you cannot, right? Not that you desire to delay ejaculation, but after 5 minutes, after 10 minutes, you really cannot ejaculate, right? So that's what we call delayed ejaculation. And remember, the symptom must be a continuous period of at least 6 months. It's when you can make a diagnosis that truly you are having premature ejaculation, right? And again, maybe your partner, your partner may be enjoying that. Maybe you are lasting too long in bed, so such that she's getting satisfied, right? But again, others may feel pain, right? Just imagine maybe after 45 minutes of continuous sexual stimulation, maybe your partner reaches to a point where she's having vaginal dryness, right? If she's having vaginal dryness, basically, obviously she will have a lot of pain, right? So again, this can cause a lot of distress. This can cause a lot of stress to your partner, right? Some may enjoy it because maybe you are taking too long in bed and they are enjoying it, right? They are getting satisfied. Some may have pain. They have reached to a point of vaginal dryness, right? And now they are having a lot of pain. And again, others may question their attractiveness. Maybe they had stories with their other friends in other relationship that maybe they are guys. Maybe they take maybe 5 minutes, they are satisfied. Maybe they are taking 10 minutes, again they are satisfied. And your ear, maybe you are taking 50 minutes, maybe, or maybe 30 minutes, right? And are still continuing the process, right? Not that you want, but because you're having delayed ejaculation. This may make her to question her attractiveness, right? Yes. And again, others may question your infidelity as a man, right? So it's a whole process, it's a whole cascade of events, right? So it may cause pain to your partner. Maybe she has reached vaginal dryness, you have not attained your climax, right? Because you're having delayed ejaculation. Maybe she'll be enjoying, maybe because you're taking too long in bed. So it involves a lot, right? Yes. So basically, delayed ejaculation, it affects many people, right? Many people wonder what's the cause, why is it I'm taking too long? Some people are enjoying, right? But again, you can delay ejaculation. It's not a problem if it's your desire to ejaculate, to delay ejaculation, right? It's not a problem because you chose to delay, maybe to satisfy your partner, maybe to prolong the sexual activity. But in a case where this delay, you really don't desire to have delayed ejaculation, right? You take too long to ejaculate, right? It causes you distress, maybe to your partner, maybe to you, right? That is now what we call delayed ejaculation for a period of 30 to 45 minutes. You really want to ejaculate, but you cannot, right? So that is what we call delayed ejaculation for a minimum period of at least 6 months of symptoms, right? Yes. So that is what delayed ejaculation means. Let's go to classification. How is it classified? We have 4 classification of delayed ejaculation, right? The first classification is what we call lifelong delayed ejaculation. Lifelong. What does it mean? From the onset of your sexual maturity, you've never attained orgasm. You've never attained sexual, what we call sexual climax. You've never attained, right? You've never had orgasm. So that's what we call lifelong ejaculation. So basically, this is a problem. This is a very, very big problem, right? Because how can you give birth when you don't ejaculate and don't ejaculate in the right place, right? You can only give birth when you ejaculate in the right place, right? Basically, maybe in the right time, right? Yes. So that is lifelong delayed ejaculation. We have acquired delayed ejaculation. From the onset of sexual maturity, maybe you had a normal sexual response cycle, right? You had the normal sexual response cycle where you had the desire, the excitement, the plateau phase, the resolution, and then finally you had orgasm, then finally the resolution phase, right? So, in acquired delayed ejaculation, you acquire it after some time. You really, initially you had a normal sexual response cycle. You had orgasm normally during your own desire, right? But it reaches a point that now that you really want to ejaculate, but you cannot, right? You acquire it during the process, right? So that is what we call acquired delayed ejaculation. The third classification, we have what we call generalized delayed ejaculation. In generalized delayed ejaculation, what is it basically? It is not limited to the type of partner, maybe to the kind of sexual stimulation, right? It can occur to any partner. Maybe you've changed a partner, right? So if you change maybe a partner, you have a new signing, right? It can happen to that new signing. Maybe after some time you adapt and then you gain your normal sexual response cycle, right? So that is what we call generalized delayed ejaculation. Then the last classification of delayed ejaculation, it was we call situational delayed ejaculation, right? Maybe when you are drunk, you get delayed ejaculation. Maybe when you are sober, you don't have it, right? So it depends on the situation you are in. It happens depending on the different situations of your life. Basically, maybe when you're drunk, maybe you take too long to ejaculate, right? So we have 4 classification. We have lifelong, we have acquired delayed ejaculation, we have generalized delayed ejaculation, we have the last one, which we said is situational delayed ejaculation, right? Yes, up to there, I hope we are together. Yes, so when can you see your doctor? When basically can you see your doctor, right? So you need to see your doctor when delayed ejaculation is a problem or is an issue for you and your partner, right? I've talked about vaginal dryness, right? Maybe you've taken 45 minutes of continued sexual stimulation, right? Your partner maybe has reached a point where they have gotten to a point of vaginal dryness, right? There's no lubrication. Maybe after 45 minutes, after 30 minutes of continuous vaginal stimulation, right? They have reached a point of vaginal dryness. This can cause them a lot of pain, right? What we call dyspareunia, right? A lot of pain during sex. And this may be a major problem for you and your partner. So, kindly see the doctor. Kindly see the doctor, right? When delayed ejaculation is an issue for you and your partner, right? Basically, during the sexual response cycle, where your partner has reached the vaginal dryness and she's experiencing a lot of pain. See your doctor, right? Yes. You can also see your doctor when there are certain medical conditions that there's may be linked to delayed ejaculation. For example, you have stroke, right? Maybe you have spinal cord injury. So this can cause delayed ejaculation, right? If you have any medical condition that may be linked to delayed ejaculation, you need to see your doctor. Maybe you have the spinal cord injury, maybe you had an accident, right? Maybe you have stroke or what we call cerebrovascular accident. See your doctor, right? For immediate solution so that it can be sorted out, right? So another reason why you need really to see your doctor is is when you are using certain medications that can cause delayed ejaculation. There's certain medication that one of their side effects is delayed ejaculation. So when maybe you are on antidepressants, maybe you are on antipsychotics, right? You really need to see your doctor, because one of the main side effects of antidepressants, especially the SSRI group, is delayed ejaculation, right? So maybe you're having sexual intercourse with your partner, you continue continuously experiencing delayed ejaculation. The cause may be because you are taking antidepressants, maybe because you're taking these antipsychotics, right? So you really need to see your doctor. Your doctor may either recommend a change in dosage or a change in the whole medication, right? So you really need to see your doctor. It may be a cause of delayed ejaculation, right? So that's the third reason. The fourth reason why you need to see your doctor if you are experiencing delayed ejaculation, when you need to see your doctor is when you have other symptoms along with the delayed ejaculation. You have other symptoms along with the delayed ejaculation. For example, pain during sex, right? Vaginal dryness is one of the main causes of pain during sex, right? So maybe because of continuous stimulation, because of continuous sex, right? Maybe 45 minutes, your partner has reached that point of vaginal dryness, and she's experiencing a lot of pain, right? So you really need to see your doctor for solution, right? So the first time when you need to see your doctor is when this is delayed ejaculation is a problem for you and your partner, right? The second time you need to see the doctor when maybe you have other medical conditions that may be linked to delayed ejaculation, where, for example, you have spinal cord injury, for example, you have stroke, right? They cause they really can cause delayed ejaculation, right? Another time you need to see the doctor is when you are taking medications, for example, antidepressants and psychotics, which can cause delayed ejaculation, right? And the last one is when you have other symptoms along with delayed ejaculation, for example, pain during sex, right? Yes, so I hope you learned something. I've talked about the definition. What is it? Basically, marked delayed ejaculation for a period of 30 to 45 minutes. If it's not your desire to delay ejaculation, you really want to ejaculate maybe after 5 minutes, but you take 30 to 45 minutes to achieve orgasm with a lot of difficulties for a minimum period of at least 6 months, right? And this causes you distress maybe between for you and your partner, right? That is delayed ejaculation, right? I've talked about classification. We have lifelong, we have acquired delayed ejaculation, we have generalized delayed ejaculation, and we have the last one is situational, right? Yes.